What's going on? It's Chris here with Man of Health Channel, here to talk about the #1 killer of people worldwide. Do you know what that #1 killer is? I'm gonna give you guys 3 seconds. Hypertension. Yes, high blood pressure claims 10 million lives every year. Yes, you heard me right. 10 million lives. That's sickening. That's crazy. That's something that can be prevented. Yes, high blood pressure can be prevented. Don't listen to all those people that tell you that it can't be, prevented. Yes, it can. Something that can be prevented claims 10 million lives every year. In this video, I'm going to tell you exactly what is high blood pressure, what are the symptoms, how it is usually treated, and I'm going to give you guys at the end of the video, if you stay tuned, 5 quick tips that can totally get rid of this disease. Yes, 5 quick tips, and this isn't your normal tips that you hear every single day, like exercise for 30 minutes, which is good, but I'm gonna give you guys 5 man of health tips that can help you get rid of this disease once and for all. I'm Chris from Man of Health Channel. Let's get started now. So what is hypertension and what causes hypertension? The first thing we're going to do in this quick lesson is eliminate the word hypertension. Let's use what we use. Let's use the words high blood pressure. So what is high blood pressure and what causes high blood pressure? I think that sounds much better. Yeah, much better. High blood pressure. So what is high blood pressure? If you remember, you have 2 main vessels in your body. You have veins and you have arteries. Remember, arteries carry blood away from the heart. The way I remember that is artery starts with an A and away starts with an A. So arteries carry blood away from the heart. Quick example. If your kidneys need blood, your heart is going to pump blood away from it down to the kidneys, and the way it does that by using arteries. So high blood pressure is pressure built up in those arteries as they carry blood away from the heart. That's a quick way to remember that. That's how I remember it. So that is what is high blood pressure, is a buildup of pressure in the arteries that carry blood away from the heart. That's a quick way to remember it. So what causes it? There are 2 primary causes of high blood pressure. You have primary high blood pressure, which is also called essential high blood pressure. And to make that very, very simple, primary high blood pressure is basically the things that we do to ourselves to raise up the pressure in those arteries. That can be from diet, that can be from salt intake, that can be from stress. So that's one of the main one of the main categories of high blood pressure is primary, aka essential high blood pressure, and that's primarily what we do to ourselves. The second is secondary high blood pressure. Secondary high blood pressure can be caused by other medications that increase the pressure in our arteries, or it can be caused by certain diseases or congenital issues that we are just born with. So the main focus that I like to put all my energy toward is toward primary or essential high blood pressure, because we can really adjust our lifestyle and really help lower the pressure in their arteries, which actually decreases our blood pressure. Okay, guys, I have a quick analogy here to kind of piece together high blood pressure. It involves a hose, which in this case will be your arteries. It involves the faucet, in this case will be your heart. So imagine when you turn on that faucet, water normally flows through that hose and it gets to whatever source that may be. Let it be your garden, let it be, washing your car, whatever it's supposed to get to. But imagine if I walk to the end of that hose and I literally put my thumb over it to basically stop the water from flowing. What would eventually happen? The water would literally build up in that hose and it would build up pressure inside of that hose. What would happen at the faucet? If I was to literally clamp that off good enough so that no water can come out, the faucet is going to try to pump harder and harder and harder to get that water through that hose. And this is going to cause pressure not only to build up in the hose, but it actually can cause pressure to build up in your faucet. So now let's piece it back together with that being high blood pressure. Your heart has to pump blood through your vessels. anytime we have any buildup of resistance or a blockage in our basically in our vessels, anything that stops that blood from flowing through that vessel is going to cause an increase in pressure, high blood pressure. Over time, if we don't basically allow that blood to flow through that artery, guess what it does to the heart? Your heart has to pump harder and harder and harder to try to pump blood through a damaged vessel. So over time, your heart is going to keep pumping and it's going to continue to get bigger and bigger because pressure is building back up into the heart because it cannot pump it out. And this is what causes cardiomyopathy, one of the things that causes cardiomyopathy. And this is one of the things that actually causes, I'm going to be simple with you, a heart attack. If your heart is trying to pump blood through a damaged vessel and it cannot get that blood through there, the heart has to pump harder. And over time, your heart is eventually going to say, hey, big dog, this is all I had. Boom, heart attack. So I hope that's a simple analogy to remember exactly what is high blood pressure. So every time you turn on a faucet and every time you look at a water hose, think high blood pressure. What are the symptoms of high blood pressure? Okay, so I'm gonna let you guys know that high blood pressure is actually known as a silent killer because it doesn't show many symptoms whenever it's basically been there for a while. Some of the small changes that some people may notice whenever their blood pressure is going up is a headache. Some people may notice a nosebleed. Some people may notice vision changes. But overall, high blood pressure is one of those things. If you're not checking your blood pressure, you don't really stay on top of it. It can cause chronic or really bad changes inside of your body that usually doesn't show up until a lot of the damage has been done. But one of the things I'll tell somebody, if you're not on high blood pressure, you notice that, throughout the day or at random times, you actually have a headache, I would definitely really want to check your blood pressure to make sure your blood pressure is not too high. So, again, that's some of the symptoms: nosebleed, high blood pressure. You may notice, your heart beating a little bit fast, or sometimes anxiety can, be a sign of high blood pressure. But overall, high blood pressure is one of those things that's a silent killer. That's why it's so important to really maintain or check your blood pressure. I'm not saying you got to go out there, go to Walgreens and grab a blood pressure machine and check your blood pressure every single day. No, but it's one of those things where, I will at least connect with my primary care doctor and, maybe get it checked once, maybe twice a year. And if you notice that it's normal whenever you're in a clinic setting, you're probably okay, because blood pressures tend to run a little bit higher when you're in a clinic. But if it's one of those things where if you go to the clinic and it's high, I would definitely go get a blood pressure machine, check it, for a few days afterwards. And then if it's still high, I would talk to my primary care doctor about some treatment options, which is what we're going to cover next. The treatment options for high blood pressure. Okay, before I talk about the treatment options for high blood pressure, I actually want to talk about the long-term effects of high blood pressure, and allow me to kind of go on one of my rants for a second, especially when it comes to my people that look like me, black and brown people. We need to talk. Okay. So long-term effects of high blood pressure. I've been a provider for quite a long time. And what I hear a lot of people say is literally just happened this week is, my blood pressure is fine. I usually take my pills whenever I feel a headache. And I usually I don't think I really need those pills. Well, and I'll ask them, what's your blood pressure? Tell me what's your blood pressure. My blood pressure is about 165/85. And I know to take it if it gets above 180. Literally in my mind, I'm shaking my head like, no. Let me kind of break it down for you guys and tell you exactly what's going on in your, I kind of talked about it a little bit. Remember faucet, water hose, and remember the job. So let's go to it. Your overall job of your heart is to pump blood from your heart down into the major organs of your body. Is that correct? Remember that, right? So imagine if the pressure builds in that artery or that water hose over time and you get damaged so that blood cannot flow as well as it needs to those major organs. So if we're not controlling our blood pressure, right, that's damaging our vessels of our body. It's also damaging our heart, correct? So if you're not maintaining a good blood pressure of your vessels, you're damaging your heart. That's one of the long-term effects of high blood pressure. It's a term called cardiomyopathy, which is basically a fancy term of saying your heart is getting too dang big. Over time, if you allow your heart to continue to grow in size, this can actually lead to heart failure and in some cases heart attack. That's one of the long-term effects. Heart attack, heart failure. Another one of the long-term effects. Remember, you got to remember, all of this is basically coming from your body not being able to get blood to the accurate major organs of your body. So let's go over some of the major organs of your body, since some people say, hey, I don't need to maintain a good blood pressure. One of the main things that you'll notice is two of the things that we use every single day, your eyes. You have micro vessels that goes into your eyes that supplies blood flow to your eyes. So if blood pressure is not being maintained in the major arteries, a lot of times you're not getting the accurate amount of blood flow to your eyes. Over time, that can cause vision changes, and in some extreme cases, it can cause loss of vision. So that's another long-term effect of not maintaining a good blood pressure. Another major effect of not maintaining a good blood pressure is one of the main things that we see, especially in the Black community, and what we like to call it is end-stage renal disease, or basically, I gotta go on dialysis. What that means is that you're not getting accurate, basic adequate amount of blood flow to your kidneys, so your kidneys are not able to function as well as they need to. So this leads to literally your kidneys failing. So again, if you ever heard someone say, hey, I'm on dialysis, usually it maintains from two things. It can either be from bad control of their blood sugar, which we're going to make a video talking about blood glucose control and diabetes, or it can come from hypertension. Remember, I hate that word, but high blood pressure. So again, some of the long-term effects of not maintaining your blood pressure is bad eyesight because you're not getting adequate blood flow to your eyes, heart failure, heart attack, kidney issues, and another thing that's real high that a lot of people probably already know about. Again, if you're not getting adequate blood flow to those vessels start to expand. Over time, those vessels can rupture from so much pressure trying to go into it. Whenever a vessel ruptures, something crazy happens, and it's called a stroke. So again, high blood pressure and the long-term effects of high blood pressure are strokes, heart attacks, bad vision. Hey guys, I'm gonna let you guys know, your penis may stop working too. So those are some of the long-term effects of not maintaining your blood pressure. You see the reason why we call this a silent killer? So again, we gotta maintain our blood pressure. Okay, so in the medical world, how is high blood pressure treated? High blood pressure is usually what the doctor is going to do is they're going to walk straight into because doctors, nurse practitioners, we're all trained to really have a protocol for certain things. The protocol usually is you walk in, you see the blood pressure, usually you'll have the patient come back in, recheck it again at another visit just to make sure it's not what we call white coat high blood pressure, which means that your high blood pressure actually goes up whenever you're in a clinic setting. So we may get you to do that, maybe do a blood pressure diary, have you check your blood pressure at home. We'll take a look at that diary, then recheck your blood pressure again. If it's still high, usually most providers are going to start you off on a diuretic. So a diuretic is what we call, in simple terms, a water pill. We're trying to get some of the volume. So remember that faucet cuts up the volume to try to pump more water into the vessel. We're going to give you a diuretic so that we can decrease the amount of volume or the amount of water that your heart is trying to pump through. So a lot of people will be started on a medication called hydrochlorothiazide, or HCTZ. This is a diuretic that helps you basically decrease the amount of volume that's inside your body. If that doesn't work, the doctor may, begin with or may add what we call an ACE inhibitor. An example of that basically is lisinopril. It's a medication that they give you, and again, I do not want to overcomplicate this, but basically you have certain receptors in your heart that basically increases the amount of volume or the amount of pressure that it's supposed to pump to try to get the blood to your vital organs. But an ACE inhibitor is going to try to decrease that so that your heart doesn't have to pump as hard, which can increase volume. The third and fourth things that a doctor may try to put you on is a calcium channel blocker, which can be called like losartan, or your doctor may try to put you even on a beta blocker like metoprolol or carvedilol. Those are some of the medications that your doctor may try to put you on. Again, if your doctor says, hey, you need to start this medication, this is really something that you need to start. Meaning they've done their due diligence and they're thinking, hey, start this medication. And again, this is going to help maintain your blood pressure. One of the things that kind of makes me a little bit different when it comes to any type of primary care is not only do I believe that you should definitely start a patient on a medication if it's needed, but we really need to emphasize lifestyle changes. A lot of providers really, they kind of brush or barely touch on the lifestyle modifications. They want to just kind of put you on a medication and say, hey, take this, which is very important. If your doctor puts you on a medication, please start it. But you need to actually talk to them a little bit about lifestyle changes. So what are some of the lifestyle changes that you could do when it comes to high blood pressure? It's simple. Of course, exercise more. We was going to talk about that, but also some of the mental health tips. And this, again, at the beginning of the video, I told you I was going to give you guys a few tips on how to maintain your blood pressure. One of the things that I like to kind of talk about is salt. So usually salt and volume, they have a very good relationship. So as your salt intake goes up, a lot of times your volume will go up. So a lot of people notice that if their diet is very high in salt, again, that includes salt, that includes seasoned salt, that includes Tony's, that includes any of your fancy seasons. You want to take a look at that sodium intake and see exactly how much of a percent of your overall daily salt intake is going into that seasoning. So what I tend to tell patients is, okay, let's slow down on the salt. Let's try some Mrs. Dash. If they look at me with a crazy face and say, hey, I tried Mrs. Dash and it's different and it's nasty, I want to try actual salt, I'll kind of relate them back to Himalayan salt, which is pink salt. You can really buy this from most stores, and literally, excuse me, my nose is itching, and I'm not going to reshoot this video because my nose is itching. But basically, you can buy some Himalayan salt in which you kind of grind it up, and you can use that as a salt, basically, substitute. So we'll talk about lowering their salt intake to, a little bit less than 2 grams a day. So maybe like 1,500 milligrams a day. The second thing I'll tell people is, if they don't have any type of heart failure issues, is let's take a look at your potassium. And if your potassium is within a normal range, or within a low range, let's try to increase your potassium intake, because potassium actually stops salt. Again, for my chemists out there, I'm just making it very simple. Potassium increases, so increasing your potassium will decrease the amount of salt basically intake. So again, potassium will help substitute that salt intake. So again, your volume's not going up too high. Another thing that I'll tell people is, let's really decrease the amount of stress that's going on in your life. A lot of people downplay the amount of stress that they go through on a daily. And what people have to remember is, whatever things you have going on inside of your environment or inside of your mind, your body's going to react to it. So if you're having pressure at your work, in your marriage, with your kids, your body's going to tense up and it's going to make your pressure go up. And if that's something that you're dealing with every single day, if we can help decrease the amount of stress through therapeutic exercise or through just talking to the right people, if we could decrease the amount of stress, we could decrease the amount of pressure. Another thing that I like to tell people is to get adequate amount of sleeps. We're in basically in a generation or in a time where a lot of people think I have to grind harder. I got to work harder. You got to remember, you got to slow down, let your body be able to recover. So if we can get the adequate amount of sleep, this can really decrease the amount of pressure that's going on in those vessels, so that we can decrease your blood pressure. So what I kind of recap there, I like to tell people to get an adequate amount of sleep. Let's make sure that you have a potassium rich diet if you don't have any type of heart failure issues. Let's substitute the amount of salt, especially unless you use some pink salt. Let's get adequate exercise, which is important. And lastly, if your primary care doctor does put you on blood pressure medicine, let's keep that blood pressure medicine going, but let's change some of your lifestyle choices so that we can actually help get you off of that medication. Again, high blood pressure can be treated. It can be prevented. Don't worry about what they tell you. So those are some of mental health's, quick tips on how to improve your blood pressure. So there you have it, guys. We've given a quick breakdown of exactly what is hypertension, even though I hate that word. What is high blood pressure? We gave you analogies. You guys will never look at a faucet and a water hose ever, the same ever again. We told you how to treat it, how it's treated by a medical provider, and I even gave you some lifestyle modifications, pink salt, potassium-rich diet to help you decrease your blood pressure. The main thing I want you guys to walk away from this video is knowing that high blood pressure is dead serious. Remember, 10 million lives are taken every year from this disease. We need to decrease that number because high blood pressure can be prevented. Remember, I'm Chris with Mana Health Channel. I'm going to continue to pump out as many videos like this as I can for you guys and for anybody who wants to take it in. But again, this is Chris with Mana Health Channel. I'll see you in the next video where we'll talk about another men's health issue to help my guys out there. I'll see you guys. Let's go.